welcome to the stage founder and CEO of Papa, Andrew Parker.
In 2015, my grandfather needed help. He had early onset of dementia and all of a sudden needed support from my family and I. He needed someone to take him to appointments and help him out while my grandmother was out running errands and just to hang out with him. He didn't need traditional services, he didn't need home care, he didn't need bathing, he didn't need full-time help. Frankly, he needed me, but like most of us, I was busy with my daily life. And so I went to Facebook and said, who wants to be a friend of my grandpa? This wasn't a viral response or anything, but a few did reply, including Andrea, who is a med student and more than happy to spend time with my grandpa. This ended up being exactly what my family needed. It wasn't traditional services, but it was an extension of us that felt just like family. I'm Andrew Parker, and pairing my grandpa with a companion was a big aha moment for our family. We quickly realized that this wasn't just a personal problem, but a problem affecting many families just like mine. And the problem is only getting worse. People are living longer, they're less healthy, they're more chronically ill, and at the same time, they have more social needs, but they have less people to turn to. 1/4 of Americans, 65 and above, are or are in danger of becoming what is known as elder orphans. And they are exactly as they sound. They're orphans. They have no one to turn to, no one to help them, no one to spend time with them. And loneliness is reaching epidemic proportions. So much so that the US Surgeon General published an advisory calling loneliness the next public health crisis. And that's because loneliness is like a disease. Loneliness is equivalent to your health as smoking 15 cigarettes a day. Think about that for a second. Loneliness is worse for an older adult than smoking almost a half a pack of cigs a day. People that are lonely have a 45% increased chance of dying sooner than their socially connected peers. They have a 32% increased chance of experiencing a stroke. And they have a 60% increased chance of developing dementia. What leaders like our US Surgeon General and increasingly our healthcare system are realizing is that human connection and community are essential to health. And if you could enable people, mission-minded, compassionate people that want to help, you could solve a lot of the issues facing older Americans today. And at the same time, you could affect, in a positive way, and impact some of the nation's greatest challenges in healthcare, like overuse of our emergency department services and the extraordinarily high cost that our healthcare system is known for. It is estimated that overuse of emergency services for unnecessary and often preventable needs cost the healthcare system in the United States $32 billion a year. And lonely people use it even more. There's a story in Dallas of 80 people using 4 hospitals over 5,000 times in 1 year. 80 people using 5,000 hospitals, it seems like 5,000 visits, seems like a lot. It's a really big impact. And the effect is pretty significant. The United Health is seeing far higher utilization of healthcare services now that COVID has passed. And with worsening shortages of both paid and unpaid caregivers, our system simply can't keep up. Yet we continue to use traditional approaches to these non-traditional needs. That's a huge miss. It's like trying to prescribe medicine without understanding the root cause. And that's why you may have heard our healthcare system referred to as a sick care system, because that's exactly what it is. Only 20% of our healthcare is specific to medical need. The other 80% are what are widely known as social drivers of health. These are the conditions in the environment in which we are born, live, work, worship, and age. The key to solving these other healthcare challenges is to solve this other 80%. And one proven way to do that is through human connection, a solution that each and every one of us have the power to impact right now. Humans need humans. Like my dear friend Sam, who at the wonderful age of 99 loves spending time with people in the community, and you see I get a chance to spend time with him here. Sam wanted us all to know how he felt before human connection, pretty stoic, and after human connection. I think the impact to Sam and others like him is pretty clear. Think about it for a second. You're 85 years old, you don't have any family in the area, you live alone, you don't drive, you don't have a car, you're not good with technology, you are likely to be low income, and you are lonely. What would be most helpful to you? Technology to help older adults with loneliness and help them navigate resources have become increasingly popular, but technology alone will not suffice. What people in this situation truly need is another human to help them, to understand their needs, to be their advocate, and to support them. Non-medical social support like trips to the doctor and grocery store, help around the house, help with technology, and companionship have become a new kind of care. We call it companion care, and the data shows it works. One study of chronically ill older adults found that after pairing them with a companion, they saw 69% of them saw a significant reduction in loneliness, and 39% were no longer lonely at all. Companion care has also been known to help with certain health actions, like getting people out of the ER and getting them to their primary care visits and prevention. One such study of socially isolated older adults in Washington state found after the program, they saw a 19% increase in primary care visits, which are good for prevention, and a 20% decrease in emergency room visits. Similarly, a study in Spain found that socially connected individuals were 2 times more likely than their non-connected peers to do blood pressure screenings and cholesterol screenings. All of this lowers costs, improves quality, and most importantly, makes real impact on real people, all through human connection. There's my guest, Sam. What I've seen in my work over the past 6 years and have shared a glimpse into today, I think it's something we've all known this whole time. And it's quite simple. It's another person, like me for Sam. This is what really matters in healthcare and what really moves the needle on people's outcome. From what I've shared today, from my experience, and what I've made as part of my mission, and me as being part of the solution, is to really help people like Sam on a daily basis. And each and every one of us have the ability to help in some way, shape, or form. Maybe you call your older relative you haven't spoken to in a while. Maybe you knock on that lonely neighbor's door. Or maybe you just help someone on the street that you see struggling. We all hold the keys to improve the health and well-being of those around us. And our actions, no matter how small, do add up to a real big change. The RX is human, and so is the solution. Thank you.